Welcome to another Practice Medical Cases with MedicoMedics. Before we dive in, if you want more high-yield practical clinical cases just like this one, make sure to like and drop a comment below. Let's get to it. A 25-year-old man is brought to the emergency department after being struck in the chest with a baseball. He loses consciousness briefly but regains it en route. On examination, he is alert but confused. Vital signs show BP 80/50, heart rate is 110, respiratory rate is 220 per minute. His neck veins are distended, heart sounds are distant, Pulsus paradoxus is present. An echocardiography reveals fluid in the pericardial sac compressing the heart. The attending physician explains that the heart's inability to properly fill during diastole is the cause of this patient's hypotension. So which of the following cardiac chambers is most likely to be first affected by this process? Is it A, left atrium, left ventricle, right atrium, right ventricle, or the pulmonary veins? Feel free to pause the video, take a few seconds, and then we go on with the answer. If you've selected C, right atrium, then you are correct. Why? Well, this patient has clearly cardiac tamponade, which is a condition where fluid in the pericardial sac compresses the heart and impairs diastolic filling, leading to reduced stroke volume and hypotension. Now, why is it the right atrium? Well, the right atrium, seen in the image here, is this one, right? The right atrium has the lowest pressure of all cardiac chambers. So it is first to be compressed when intrapericardial pressure rises. And this is what leads to impaired venous return. You get an elevated jugular venous pressure and decreased preload to both ventricles. So we have excess fluid accumulated in the pericardial sac, which the heart is sort of resting in, right? Now this fluid, seen here in blue, as you can see indicated, it's pressuring the heart. Now, this leads to the inability of the heart to beat outwards as per normal, because something outside is pressuring it inwards. Now, we also mentioned that the right atrium, right, where blood from the upper part of our body through the superior vena cava and the lower extremities through our inferior vena cava is returning. Deoxygenated blood is returning back to the right atrium, right? But due to the compression happening mainly on the right atrium, there will be a back pressure. And this is why, if we look at the patient example, we see neck veins are distended. Right? The jugular veins are distended because there is a pressure upwards. Now, over time, the right ventricle as well, right? We have the right atrium here. The right ventricle, seen here, and then the left-sided chambers, so the left atrium and the left ventricles, may also become impaired. But the initial physiological impact is on the thin-walled right atrium. So why is it not left atrium? Well, the reason is it's located posteriorly and is relatively protected. It has a higher filling pressure than the right atrium and is less affected in early tamponade. Why not the left ventricle? Well, this is a high pressure chamber with very thick walls, and this is only affected in late stages. What about the right ventricle? It's affected after the right atrium, especially during inspiration. What about the pulmonary veins? Well, they're not within the pericardial sac, they're outside and upstream from the heart, so they're not compressed directly in tamponade. Now here is the review. So normal heart flow. We have systemic veins delivering blood to our right atrium, continues to the right ventricle, through the pulmonary arteries, arrive at our lungs where it's getting oxygenated, returns with the pulmonary veins back to the left atrium, to the left ventricle, through the aorta, out to the body. Some key physiological principles. The right side. So this is where the pressure is lower and is volume sensitive, compared to the left side where pressure is higher. This is force generating because blood is leaving to our body from our left ventricle. Diastolic filling depends on pressure gradients and compliance. Pericardial diseases like tamponade impairs low pressure fillings first. Now we mentioned a phenomenon known as Pulsus paradoxus, and it was present here in this patient. Now, Pulsus paradoxus means the systolic blood pressure drops more than 10 millimeter mercury when the patient is inhaling. It happens in conditions like this one, so cardiac tamponade, because the right side of the heart overfills during inspiration and pushes the septum into the left ventricle, reducing left-sided output. So you take a deep breath, more blood to the right heart, right? This squishes the left heart, less output. And if systolic blood pressure drops more than 10 millimeters mercury, we say Pulsus paradoxus. Furthermore, just for those who want to revise, the tamponade triad are the Beck's triad. So we have hypotension, 80/50, that's hypotension. We have the distension of the jugular veins. That was also a check with the distended veins here, and muffled heart sounds. So this is a clear example of cardiac tamponade. And that's the end of this case example. Until next time, keep it clinical.